As with all types of nursing, there are many knowledge domains that a forensic nurse must be familiar with. First and foremost is the nursing process in general, otherwise known as ADPI. However, forensic nurses must practice ADPI within a therapeutic alliance with patients who might be at risk for criminal behavior or who have practiced criminal behavior in the past. In other words, forensic nurses need the ability to combine typical nursing skills with the knowledge of the specificity of the situation at hand. Oftentimes, these situations can be extremely varied, from dealing with a patient who is victim of sexual assault to treating a patient who is incarcerated for a serious crime. Forensic nurses also need to be familiar with mental health nursing skills, as many patients are at risk for psychopathic or personality disorders. The ability to maintain security, as well as the comprehension of the legal system, are all integral roles when practicing in potentially dangerous situations. Likewise, risk management and management of violence, as well as providing therapy, are all very important, including the ability to behave with a non-judgmental attitude and with empathy, but while still considering the patient's past. In a similar vein, the ability to be respectful to the families and communities of the patients, and the ability to avoid the stigma or discriminatory behaviors that are often faced by patients who are incarcerated, are all integral to the forensic nurse. The ability to pick up on potential for abuse or to improve patient legal outcome are all major skills that a forensic nurse must master. The forensic nurse must also be an advocate for community awareness and prevention programs. Finally, because many forensic nurses practice in jail or other similar correction facilities, documentation is incredibly important. There are also some knowledge domains and skills that forensic nurses need to improve. Primarily, forensic nurses should focus more on prevention and community awareness programs. Rather than only treating the criminal or the victim, it is the responsibility of the forensic nurse to develop methods to prevent these terrible crimes. Also important is the need to receive a better education on clients with psychopathic and personality disorders, as many forensic nurses are underqualified to deal with such problems, but might face them on a regular basis. Forensic nurses work with a variety of fields. Monica Harmon told us that on an average day, a forensic nurse might interact with a medical doctor, physician's assistant, or nurse practitioner, as well as an RN who is usually the charge nurse in the infirmary. Pharmaceutical nurses run lines and order stock medications, such as Motrin, aspirin, and other over-the-counter drugs. Hallway nurses run sick call, triage, and emergency situations, while infectious disease nurses, correction healthcare administrators, medical record supervisors, and dentists all play major roles in the daily practice of the forensic nurse. Unique to forensic nursing, however, is the fact that an officer or security guard must always be stationed with the nurse for safety purposes. As with all other types of nursing, there are many technologies developing in the forensic nursing field, which you can hear about from Michelle now.